Hello, everyone. Welcome back for another Regional Health Update. This time around, we're going to be talking to Dr. Emmons. He is a medical oncologist at San Juan Cancer Center. He's standing by to talk to us. Good morning, doctor, and thank you so much for joining us.
Glad to be here.
So a medical oncologist, when someone gets diagnosed with cancer, you're the guy that they go to, correct?
Yes, typically we're the first person. Sometimes you'll see a surgeon first, say sometimes with an early breast cancer found based on mammography, you'll end up seeing the surgeon first and then myself second. Usually we end up, once a diagnosis is made, we're usually involved pretty relatively early in the process.
I consider you and cardiologists the heavy of the medical community. What made you interested in becoming an oncologist?
So this is career number 2 for me. I actually went to a small SUNY school, State University of New York School in Western New York State, Fredonia, which I'm sure nobody's ever heard of, unless you're from Buffalo. But I was involved in basic sciences at that point in time, laboratory work, and I'd always had an interest in medicine. But the reality is I didn't necessarily have mentors there, and I ended up going to graduate school in Tucson, University of Arizona, in microbiology and immunology, and then thereafter, when I was a technician working in a molecular biology laboratory at a much larger university system, I had much more exposure to medicine. And additionally, being in molecular biology, which is what I did then, was you could really see how molecular biology was moving forward, aiding in the diagnosis and treatment of cancers, which historically has been, of course, chemotherapy, which is heavy duty, and now we're doing more targeted therapy or immunotherapy.
Yeah.
And then lastly, why oncology? Because of that reason, because I've always had an interest in taking care of cancer patients. Indeed, I spent a year volunteering in a hospice. And what really consolidated this was my third year of fellowship. My own son was diagnosed with Burkitt's lymphoma, so my wife and I went through all that
on
a personal level. He was in the hospital for the better part of a year. I have nothing but wonderful things to say about my mentors and faculty back at the University of Vermont, who were incredibly supportive when we were, frankly, all going through hell. But it really did consolidate why am I an oncologist. You kind of go through it personally, and you find a lot of people in this field have unfortunate or fortunately very personal experience with it, and where we tend to be very dedicated to the field and to the patients.
Tell us a little bit about some of the services that you provide over there at San Juan Cancer Center.
So for the size of the city, it's pretty extensive. So what is the San Juan Cancer Center? Of course, on the second floor, there's the medical oncologist, and we tend to see people on one side of the building on the second floor, and then typically give therapy on the other side. And this is not only medical oncology or solid tumors, but also hematology, which can be malignant hematology or additionally benign hematology. So sometimes we'll be involved in the management of iron deficiency anemia or other benign processes. And indeed, we're board certified in hematology and oncology. So on the second floor is the medical oncology service, and then on the first floor, in conjunction with SCL, which I guess is soon to be Intermountain, is the radiation oncology services. And so we tend to work very, very closely. So you'll find Dr. Oldroyd will come upstairs, or I'll go downstairs pretty commonly, and Dr. Oldroyd actually has partners in Grand Junction who come up. We tend to work very closely, and in conjunction with that, we often will reach out to our surgeon collaborators, and we actually do meet for a tumor board every other week. Additional things here at the Cancer Center include each physician has a primary nurse or nurse navigator that works very closely with the physician. So a first call from a patient ends up going to the navigator first, and they're great. Yeah, you pretty much have to have a navigator. I couldn't do my job without them, frankly. Additionally, there's also an excellent social worker, Perla here, who is really a go-to person when people have a lot of psychosocial needs, which obviously always happens in cancer. It's just the reality of the disease. And then lastly, of course, we have a dedicated staff and scheduling crew, which, I mean, they're just outstanding. Really about the best I've ever worked with in my life, honestly. But the nice thing about the Cancer Center is it's really everything here for a city this size is in one building. Now, granted, sometimes we have to have people go over to see the surgeons or whatnot, and once in a while people have to go into the hospital, and one of the nice things is we're literally a very short walk from the hospital. We can get people over to the hospital very quickly if we need to.
What do you think it has meant to Montrose and the community just to have this cancer center nearby?
Oh, I think it's huge. I mean, I have worked in several cities, bigger and smaller. I mean, I was a university professor in Vermont, and, of course, that's a level 1 center that was NCCN designation. That was a big institution, but I've also worked in smaller cities such as Saranac Lake, New York, and great organization, but, did you have everything kind of in one entity? The answer is no, and it made a lot of phone calls, and sometimes, for instance, I'd have to send somebody down, 40 or 50 miles to get the radiation therapy, which is the reality of rural medicine, and you don't really run into having a city this size, cancer centers, where everything's in one building. This is more the exception than not in a city this size, in my experience.
What do you think the future of cancer care is for San Juan Cancer Center itself?
So we're doing a couple things. One thing we're working on is getting the Commission on Cancer designation, and that's been around for about 100 years. Initially started with the surgeons long before, really there was the field of medical oncology and radiation oncology. And the idea is Commission on Cancer tries to get all the players together for the benefit of the patient. And by I mean players, I don't just mean the doctors. Yes, there's medical oncology, radiation oncology, surgeons, but there's also the primary care physicians, there's nutrition, there's speech pathology, social work, palliative care, pretty much everybody. And the goal of this is to get everybody together to work on the same page at the same table for the benefit of the patient. That's one of our goals. And of course, what we do this is we're trying to get complete standardization with the NCCN. So what the NCCN is the National Comprehensive Cancer Network. And what that is a consortium of about 40 or so cancer centers, academic cancer centers throughout the country. And one of the nice things they do is they literally have a very, very detailed document, which we as physicians, oncologists, community oncologists all work from. And really, the idea is we standardize all of this. And what it allows me to do as a community oncologist to really stand on their shoulders of saying, hey, this is the standard of care, this is all level 1 recommendations, this is what we do. And of course, if we need to, we can always contact folks at the University of Colorado or University of Utah if indicated. But that's another thing we're doing, and we're in also the process of strengthening the nurse navigator role.
So what you're saying, you're not a slout.
No, I don't think we are. Well, we're all board certified. I mean, I
only mean that in a good way, doctor.
No. We the thing about physicians is we all kind of train the same way, I think we're really bringing standard of care considered at the university centers to Montrose, and of course, all three of us are acutely aware. When is it time for you to go to the university center? For instance, on acute leukemia, we're the first ones to say, hey, you need to go to the University of Colorado or you need to go to CBCI, which is a large private group in Denver. You're better served there, and we're always happy to come back and take care of you afterwards, and we work together with them both, but it's all for the best of the patient.
Dr. Emmons, thank you so much for taking time out of your busy schedule. We have some great stuff to mull over there. Thank you again for joining us.
Thank you. Happy to help.
Join us again next time for another Regional Health Update. I am your host, Michael Moon, and just remember, information provided in this podcast is for informational and educational purposes only and is not meant to diagnose any condition or provide treatment advice. Please work with your healthcare providers to determine appropriate treatments for you. Thanks again. We'll talk to you next time around.